Hey everybody, my name is Matthew Estrad. I am a caregiver support group facilitator for the Council on Aging in St. Tammany or Coast, and bringing some more videos to you in 2026. Today's topic is going to be how to recognize pain in older adults, especially if they have dementia, if they have Alzheimer's or another type of dementia. So, really important topic because many times it is missed by even the most astute and caring caregiver. So we'll talk about all the reasons why it may be hard to recognize, and what are those signs that we want to be looking for, behavioral signs, physical signs, what to do about it. Before we get into this topic on pain, just a little bit, wanted to share some information about the caregiver support group. Now, you may have seen me open just about every other video about this. And we do that because you may only watch one video, we don't know. So anyway, here it goes, the spiel of our caregiver support group our caregiver support group that is sponsored by the Council on Aging in St. Tammany. We meet every Tuesday of the month, or at least 4 Tuesdays of the month. And I encourage you to get a hold of the specific calendar that we put out every 2 months that has the dates, the times, that has Zoom links when we do that. So all the information, because even though we follow a pattern, if I happen to be out of town on a Tuesday, I'm going to still have that support group, hopefully sometime during that week. And so it's important to know that, and especially as we get around holidays, if we have to move something because of a holiday, the flyer and calendar is the best bet. And you also want to subscribe to the free private email subscriber list, because that's going to get you a reminder the day of the group, or sometimes the day before that group. So the basic pattern, though, if you don't have the calendar, the basic pattern is the first Tuesday of the month. We're in person at the Slidell Activity Center. The second Tuesday of the month, we're on the Zoom platform, so you can join us with your computer, your smartphone, your tablet. You can even, join with just audio, as just like one of the what we used to have, the conference calls, the phone conference calls. So that's the first 2 weeks, first 2 Tuesdays. The third Tuesday of the month, we're back in person at the Covington Activity Center. And then the fourth Tuesday, we are back on Zoom. Now, sometimes there's a fifth Tuesday in the month that happens a few times each year. Sometimes we meet, sometimes we don't. We always put it tentative on the calendar, and we confirm when we're able to, what the answer is, whether we're meeting or not meeting. So just stay tuned for those things. You can go to the coastseniors.org website, and you can download the most recent flyer, and you'll see on the flyer how to join that free email distribution list. So let's get into this topic: how to recognize pain in older adults, especially if they have Alzheimer's or another type of dementia, because they don't always say it. So why is pain often missed? One big factor is dementia or communication problems from that condition. So it may be that the person is not able to. Many times, someone living with dementia, not always, but many times, they're not able to express that they are going through pain. They certainly still feel pain, but if they're having it, they're not able to tell you, just like I'm able to tell you that my shoulder is sore. So we still need to figure these things out. So here we'll talk about it. Another reason is stoicism is why they may not say something. So they may be cognitively intact, but they don't want to be a burden. And if they reveal that they're feeling pain in some ways, you're gonna assumably you're gonna help them, but they don't want to feel like a burden. They don't want to feel like they need that type of help. So, and I know some people might say, my loved one has no problem telling me that they're in pain. But we're talking about the opposite, where they don't want to share that because they don't want the attention. They don't want to feel like a burden for their loved one. One reason, and again, this is if they're if they're cognitively intact, so if they're not experiencing dementia, could be a fear of medication. So if I say that I have arthritis, um, I may be afraid that you're just gonna, give me lots of medications and I don't want medications and or I'm on enough of them or I don't want any at all. So they may not disclose that because they're in fear that they're going to be prescribed things that they don't want to, and then they're going to feel loopy and all that. So this is a possibility. And the last one we'll talk about is that we mislabel pain as behavior, meaning the person is in pain, they're not able to express it, but it comes out as different types of behavior that are frustrating for that person, and for the many times for the family and the caregivers as well. So mislabeling pain as behavior. All right. So what are some signs of pain? Some behavioral signs. You're looking for nonverbal cues, grimacing, or frowning. It's I think it's pretty intuitive. I'm sure that makes sense to you. But the grimacing and frowning, especially when doing certain things like walking or getting up or moving in their bed or just something where they're doing something physical and you can kind of see them wince or frown. Next is guarding or protecting a certain area. Maybe they're holding that area. And these are things that we do also. Next time you're in pain, recognize or try to think about how much attention you pay to it physically. Um, so just holding an area. Withdrawal or irritability. So maybe withdrawing in this example, withdrawing from social activities, could be going to social events, could be withdrawing from going to church, could be being irritable as in having a short temper, um, just trying to kind of hide that pain, and it turns out it comes out as irritability, or a cognitive impairment, it comes out as irritability. Restlessness and pacing. So having a lot of energy, walking around the room, pacing the room up and down, that could be a sign of some kind of pain. Maybe they're trying to walk it off. It might be something that's not bothering them, and the walking might actually help them keep their mind off of it or to feel better. And then you're looking for changes in sleep patterns, like not being able to sleep. So maybe this is something sudden that happens. All of a sudden, they're not able to sleep, whereas before they were, kind of doing fine. They were in a good rhythm. So that's behavioral signs of pain. Next is physical signs of pain. They may have a reduced appetite. They might have changes in their mobility. They might not be wanting to get up as often as they normally would. So that's a sort of a change. You're used to seeing them walk around with no problem, but now they're sort of, kind of staying in place. Increased confusion. And of course that can be, lots of things, but certainly pain is one thing. Rapid breathing or stiffness is another physical sign. So let's shift gears and talk about pain in dementia. Certainly they could be more agitated, meaning they're being repetitive, they're hitting things in a repeated manner, they're kind of short-tempered. Agitation, it could be a lot of things, but pain, I guess we bring this up so because pain could be something that is causing the agitation. Um, Mentioned calling out, especially repeatedly, having resistance to care, resistance to bathing, resistance to eating, dressing, things like that. But so basic resistance to care in those examples. Sudden mood changes could be pain. So what do you do about it? First you want to document it. Like with a lot of things, it helps to keep a journal So you jot things down that might seem notable to you. Even if they're just bullet points, you're writing them down every day. You're even noting the times, what was happening when there was agitation, or when there was something um, that maybe was a fall, or something that happened where just a notable event. And so you're jotting it down so that days later, even weeks later, you can look back on that and say like, okay, these are some of the things that I jotted down. Am I seeing a pattern? Like, did things start on this certain date when they fell down? So that's important that you make a note of when there's an onset of something. So when it started, you want to, once you've discovered that there is pain and you're writing things down, what makes it better? Or is there something that makes it worse? How are they verbalizing things? So you're writing all these down. You're gathering clues so you can hopefully see a pattern. Is there a particular location where they're feeling pain? Is there a frequency? What is the severity? We have if you most of y'all go into the doctor in pain, and they say on a scale from 1 to 10, they even have the smiley faces, right? The frowny faces to smiley faces. Um, how painful is it? They might be able to identify on that, even with the pictures, or they might be able to verbalize it, even if they have dementia. But if they can't, hopefully they can point to the smiley face, sad face, painful face, etc. And what's the impact of the pain on their daily life? And then some examples of comfort measures. Hopefully you've discovered something. Hopefully you see some patterns. You can kind of pinpoint to where it is, like what happened, where the pain is. So then you can take some, you can go forward with some strategies on things to relieve that pain. So think about heating pads, and always be safe with those. But heating pads could be repositioning, every certain amount, pick an amount of time, 15 minutes, repositioning them if that helps them, making sure that they're properly hydrated. And that can be sips of water, sips of tea. It could be ice chips, but as long as they're getting some kind of, hydration, constantly. And then gentle movement is important, in making sure that when you're helping them with a task, maybe you're helping them with bathing, or you're helping them brush their teeth. You're looking for ways to where you're not causing more pain, and rather you are actually doing things for them, and with them, so that they are feeling comforted. So using more gentle movement, maybe even taking some medicine, if before these type of activities, so there's time for the medicine to start working in a preventative way before you bathe, and before you brush your teeth, and before you do other things that might be more physical. So, all right. Well, I hope this has been helpful for you. I hope that it was enlightening, that you'll take some things and put them into action, because that's why Coast has asked me to do these videos. Not simply for entertainment, but for you to take action on them. And I will be hoping and sending positive thoughts for you to put the work in on these, to have the courage, to have the perseverance to just take 2 to 3 things from this video, start putting them into action. Even the smallest thing could show some improvement and help you in this particular topic of discovering pain, tracking the pain, and helping to relieve it. So thanks a lot for watching all the way through, and look forward to you joining us for future videos. And remember to share if you found this helpful. Thanks.